Welcome to Morning Infusion with Dr. V. Have you ever wondered what it would be like to be a nurse educator and serve nurses in a different way? Well, stay tuned to our next guest. My name is Dr. Viola Pierce. I'm the owner and the CEO of VP Nursing and the Nurse Nurturer and the facilitator of Secret Suppers Worldwide with Dr. V, where our goal is to equip healthcare professionals to be wealthy in all areas of their lives. Our goal is to come to you each Monday, Wednesday, and Friday at 7:30 a.m. Eastern Standard Time to give you the fuel to crush your goals to show up exceptional on a daily basis. You can follow us on Twitter at The Nurse Nurturer, Instagram at VP Nursing. If you're watching on YouTube, then don't forget to hit the subscribe button. And please share this video. You can also visit us at our website at vpnursing.com. Okay, so we have a special guest today. Her name is Cathy Bellamy, but I don't know exactly what happened to her video. So I'm not, Cathy, can you still hear me? Okay, so I'm just going to go on and talk and tell you guys about something that I learned today. Today, I was listening to Patrice Washington's Wealth Defining podcast, and she was talking today about the end of 2020 and how us as healthcare professionals, as anybody, we counted out 2020, and we said today that we're just going to wait until 2021, when 2021 may not bring anything very differently, and that you have to move in expectancy, and you have to make sure that you are doing what you need to do in order to move things forward. You see, you are an amazing group of people. And, what we do a lot of times is we sit and we just kind of pause, and we pause because we don't understand what our purpose is. And when you walk in your purpose, things change dramatically. Things change where you are doing what when you're walking in your purpose and things, you're walking every day in everything that you're doing. So for me, my purpose is to help healthcare professionals to build wealth, right? And it's not just building wealth because I want healthcare professionals to be rich. That would be great, right? But it's walking into your purpose, because there's plenty of people that are rich and they struggle. They struggle with what's going on. They struggle with the perils of life. I mean, look at some of our icons, for example, who have committed suicide. Robin Williams, for example. Kate Spade, for example. And it's unfortunate that they committed suicide, but they committed. That tells you that being wealthy or being rich per se with money does not give you everything that you need. And so I just wanted to come to you today and just really talk about that wealth and that pivot. And so, like, in this moment, right? In this moment where she's not on, Cathy's not on because of some technical difficulties that she may be having. We can sit and we can just not do anything. But the reality is that I said that for 75 days, I was going to go live. I was going to do 4 miles a day. I was going to read a proverb. I was going to do everything all those things that I said that I was going to do. And so it's pivoting in the moment and not being stuck in the fact, okay, well, this didn't happen, so I just need to stop. No, that's not what you need to do. You need to keep moving forward, because keeping moving forward is what's going to get you to your goal. It's going to get you to where you need to be. It's going to let people know who you are and how you are. And I just encourage you from this point forward to be very intentional about moving into your space, moving to where you need to be. So she looks like she's come back. Let's see. Hey, Cathy.
Hi.
Okay. So we're live. So I was just talking till you came back. So our special guest today is Cathy Bellamy. Cathy Bellamy is a nurse educator and manager of education services at her local hospital. She has spent most of her career in the frontline leadership roles as clinical nurse supervisor, pain management supervisor, and nurse manager in various medical, surgical, and postoperative care. Her last 14 years have been concentrated in nurse education, training with the community college system as adjunct faculty, and maintaining a full-time position as a nurse educator and nurse planner with her employing hospital. So welcome, welcome, welcome. I'm super excited to have you.
Thank you so much for having me on. Sorry, sorry about the technical glitch, but I'm here and I'm so excited to be here.
Good, good. Yeah, I was just discussing while you were not here is that we need to move an intention, and we need to be wherever we want to be or need to be, regardless of how many technical glitches go on, because the devil kind of puts those stops in front of us. But
Right.
we don't need to stop. We just need to keep going. The person who has failed is the person who doesn't get up again, right? And the person who gets up again every time, that is a person who succeeds. So it is a wonderful way of being. So now tell us a little bit about yourself. So why did you become a nurse?
Many years ago, I lived way out in the country with my family. And unfortunately, my father contracted tuberculosis.
Mm,
And back in the 70s, you had more visiting nurses still. So the health department would dispatch nurses to come to your home and do assessments and um, basically start the treatment at the house. Of course, back in those days, we were still sending people to sanitariums to treat tuberculosis. But the nurse that came to the house was so professional. She was classic white shoes, white uniform. She had a little black cape on and a cap. A little scary, but I was so impressed with her that it sort of started my journey because I saw the help she provided to my father and to the family with screening us for tuberculosis. And I said, I would love to do that one day to be able to help people like that.
yeah, that is super cool. I do remember that white hat. And I'm a fan of white, but that whole white hat, I was like, look, I'm about sick of that right there.
Totally the classic nurse, I don't think a piece of dirt ever entered her uniform. She was always immaculately dressed every time she got there. Little carry bag and everything. So
Gotta love it.
that
Gotta
was
love it.
when I said, I would love not so much the scary part, but I would love to be someone who would help people like that.
Now, who are some of the people that you look to for inspiration and mentorship?
Um, Mostly, we'll start with leaders. I had a supervisor, and she used to be with Vital Health. Her name was Janet Mullaney.
Oh,
Uh,
yes.
was a big influencer in my life because she taught me many things about leadership, about what you should do. You should always be that visible leader. You should always interact with people on their level. Don't let your title supersede what you're doing. Um, and then someone who has passed on now. She used to be in charge of our nutrition department at the hospital. Her name was Mamie Shaw. She was the ultimate professional.
Yes.
And she sort of took me under her wing at an early age. And She took me under her wing at an early age and basically taught me about being that professional leader, even to the point of always telling me Miss B, when you come to work, I always need you to wear pantyhose. I don't need bare legs in the hospital and things like that. But those were two big influencers. But it wasn't just the leaders. As I have worked throughout the years, quite a few, um, just peers like yourself, other people who do great jobs in their work environment have inspired and motivated me. Someone who says, I want to go back to school, and you sort of say, I admire their tenacity, that they have 5 kids and work in a full-time job, and they still want to do that. And so to me, that inspires me, that there's always something you can plan for, something you can impact somebody's life with. So those are some of the things I look for, not just in the leaders that have impacted me, but also in the people I have worked with along the way.
And Miss Mamie Shaw, she impacted my life because she really helped me know how to show up. Literally, I mean, just in that showing up professional,
Mm-hmm.
looking
Exactly.
like, I mean, walking, showing up like you are going to show up. Just because you are not in a leadership role right now, showing up and looking like a boss. I
Mm-hmm.
don't care whether you are where you are. And I mean, that lady right there, I absolutely love her. And Janet Mullaney, yes, too. I mean, she was amazing, and she was that visible leader.
Yes.
And she really, really taught me a great, great deal. So what are some of the qualities that are lacking among today's leaders?
Some of the things I just mentioned, we have become a computer driven system and an email driven system, that the talking part and daily interaction part has sort of taken a back seat. We communicate through technology. We send emails, we leave voicemails, we text on our phones, but the personal interaction has sort of drifted away. We are told as leaders to be visible and to make rounds and talk to your staff, because that is one of the most important things, hearing what people you work with have to say. But a lot of times that piece has taken a back seat to financials and things like that. Financials are important because any business has to survive on financials. That's not what I'm saying. What I'm saying is that the actual people, when you become a leader, it's more about how you interact with people, because the people do the work.
That's right.
Is how you interact with them. And that is something that has drifted more away. Technology like we're using now, COVID has forced us to be more Zoom and web streaming people. But even with that, wear your mask, go out, let them know that I am here for you. I am visible. I understand what you're going through. And a lot of times it's not about money. Money's important because everyone wants a decent salary, but it's more about, how has my leader connected with me? How have they come and tried to understand that I have 5 COVID patients today? And it may just be that one thing you say that says, "What can I do? Is there something else I can do?" So
Yeah.
that interaction piece has drifted, and that's one of the biggest things I've seen over the years, is we don't have enough face time with the people we supervise.
That's true. That's true. That's true. And COVID has made it a little bit more difficult, as you said. But we're going to get back to where we need to be on that. Now,
Exactly.
tell me about a difficult time in your career where there were difficult decisions that you had to be made, and how you handled that.
I always go back to always reminding people, middle management is one of the most difficult roles that anyone will ever occupy.
That's right.
You are almost constantly looking at, how do I service my staff? How do I make things better for them? Also, while you are trying to leverage the fact that you have accepted a leadership position and that there are certain things that leaders require.
Hmm.
It's mainly leveraging that, but the most difficult thing is what we just went through. I've been through it several times over my career, but our system had a pretty significant layoff
Hmm.
and furloughs and cut time and things like that. That is one of the most difficult things I have had to deal with because some of the decisions were um, made at a higher level. I
Hmm.
didn't really have the ability to impact them. I had to be the one to carry out the directive. Um, the staff um, I had were impacted by what happened. When you affect someone's livelihood and how they manage their income and how they do things, even as far as childcare, it really is a difficult. So that was probably one of the most difficult times, the times over my career and recently when I had to call them in, and I always start with talk and explain to them so they understand. And then if they do have the ability to impact my decision, then I let them have some autonomy with it. With this particular time, I was just told cut hours to this level, and that had to be done. But when I called them in and explained and we talked about it, I let them vent. You always need to let people have their say. One of the things I tell people all the time, you can say what you need to say as long as you say it professionally and in the appropriate manner. So I let them talk about it. And then I said, I need to give them some autonomy with this. So instead of me making out what their schedule should look like, I said, let's see how this would benefit you. Um, you're going to make 40 hours, you're going to make 36 hours instead of 40. What would be a good schedule for you? And it was everything from, can I work 9 days and be off an extra day a week? So I gave them, and that was doable. I gave them some autonomy because people, if they have some control and autonomy, then you get more buy-in. So
That's right.
painful decision, but I said I need to let them help me get to where we got to go. So they're working with me and not just taking the directives from the leader.
That's right. That's right. When you involve them in the decision and it's their decision, hey, they're good with it. It's just like the 75-day challenge. It's so funny because I was running with a couple of my friends, walking with a couple of my friends for the 4 miles, and one of my friends, Shalana, she said, well, when you are the one who makes the decision, then you feel committed to it. So I'm the one who made the decision, so I put it out to them as accountability partners, and I was like, well, I got to do it every day because I'm the one who made the decision.
That's right. So you made it. You own
That's
it.
right. That's right.
The person that made her schedule for the 9 days, for the 9 hour days, she actually came back to me and thanked me. And she said, actually, that extra day off a week, it really works for me. I said, okay, great. Um,
Yeah.
so, it worked out that time. Don't always work out every time, but whenever you can try to talk to people, they want to be treated like adults. They don't want you just to come in and say, this is what we're going to do. Treat them like adults and say, this is something that's been put before us. Now let's look at how we can make it work.
That's right. That's right. And that has probably been one of the most common themes across the leaders that I have interviewed is that, and I think that that's what makes, such great leaders is that you are people centric. and because someone commented people eccentric leadership equals capitalism in healthcare, and that's I think that that's probably a true statement.
I
Money
think so.
can't buy you. You have to be about the people. If you pour into your staff, I can't say this enough, pour into your staff will pour into your patients. I know we get reimbursed on patient satisfaction scores, but your staff is the one who is talking to your patients.
No,
So,
everyone's doing the work, and that's why visibility is so much. If you are a leader who you lose contact with your staff, that means you lose the ability to actually see what's going on. Then you're not going to be an effective leader, because all you're doing then is saying, well, this model should work. I should let them do this. Get out, look at what they're doing. When they say something that this is not working, um, the biggest asset any company has is the workers. Because, like you said, they're
that's
doing the
right.
work.
That's right.
So if you don't see what the everyday situation is, how can you make effective decisions for them?
That's
And that's
right.
what we hear so many times in leadership. There are people in the office making decisions, but they don't know what's going on at the bedside or
Exactly.
the clinic setting. So I think you listen to people.
That's right. That's right. It was one time I had this we were in the emergency department, and it was by the nurses station. We had this room, and the staff wanted to put a few of the supplies that they needed in this room because the emergency department had doubled in size, right? And so we're having to use extra steps and not using the lean model in order to get to where we needed to be. And the leader just didn't want to do that. I mean, she was very resistant to that. So they would move the supplies to this little area, and then she would move it back with no real rationale as to the reason why she moved it back. And it caused a lot of tension when you just leave the supplies there, or at least give a valid reason as to the reason why you don't want the supplies there, right?
You're
So
always
yeah,
looking why. Yeah, why would this not be? And that's very much fundamental, not just in healthcare, but in all work settings. The lean
exactly.
model does work, but it only works if you have cooperation at the leadership level and with the staff. And how many steps would they save if they didn't have to go all the way to a different location? And how
Exactly.
much more efficient would patient care be if you left it where we put it at?
But anyway, now
That was a very specific example.
it was very, because it was real. I was like, I couldn't understand it. So tell me how to draw the line between your
It appears like you lived that one.
I did. I did. I wasn't the person who put it there. I would just witness the whole event, and I was like, I don't understand. Help me to understand what you're doing, because I just need to know, right? So what are three books that you recommend on leadership?
um, I always go back to one of the first ones I really got into, Stephen Covey's book,
And what's
um,
that one?
The Seven Habits of Highly Successful People.
People.
Uh, Covey, Covey in that book basically talks about what we've been talking about, how you interact with people, how you learned a certain style of leadership. He even goes into different styles of leadership and how it impacts people. His whole focus is how what a leader does impacts people. And for you to be successful, you have to learn. You can't lead every group the same way, because
Mm,
people are not all the same. You don't put them
that's
all in the
right.
basket and say, this is just a bag of peanuts I have today. You have different things in that basket. And so Covey was all about learning your people, learning their style. Okay. Then Simon Sinek had a book that someone let me borrow a few years ago. It called Leaders Eat Last.
Ah,
And that is a good book. I highly suggest that one. Leaders
okay.
Eat Last is all about you understanding your workforce and knowing that you have to basically put yourself out there, and you have to basically put yourself out there and know that what you do for your staff pays off 100-fold. Because unless you, I always tell people, I won't ask you to do something that I'm not willing to do.
Right.
Leaders
Right.
Eat Last is just about that, of putting your workforce first, understanding their needs, understanding what makes a good team dynamics and workforce. Okay. And then the third one is probably going to be a surprise to you, Dr. Pierce. The Bible. There are so many things a leader needs, but one of the things that a leader needs most is to understand what we've been talking about: how you treat your people, how you treat people as equals. Just because I have a title behind my name, several, that doesn't mean I'm any better than the EVS person or
That's
whatever.
exactly
Um,
right.
when I read the Bible, like Proverbs is probably written by one of the smartest men that ever lived, Solomon. Um, it tells you all the dynamics of how to treat people. Okay. So I read and I try to say, would I want somebody to say that to me? Would I
That's
want
right.
someone to that manner? Would I want someone to tell an untruth on me? And then I try not to do that to any of the people, not even people I just work with, because the relationships you form um, can last a lifetime, you know?
That's right. That's right. Someone put The Florence Prescription by Joe Ty is a great book. I don't even think I've ever heard of that. But
Mhm.
yeah, and it's treat the janitor and the CEO the same. That's exactly right because
Exactly.
they are the same. We're all one mission. One mission is to take care of the patients, to take care of them efficiently and effectively. That's the one mission. And so we have to treat everyone in the same manner. Now,
Exactly.
how do you handle those that are not performing at the level that is required? How do you keep the momentum up for those that are complaining about the non-performers?
The first thing I try to do is listen. I try to listen to what they say, and then I try to observe. I don't just say, "Oh yeah, I've heard that person do this." I want more concrete information. So if someone comes to me with a legitimate concern, I look and observe, and if I see that there really is a problem, I call the person in, I talk to them. The main thing with the conversation is seeing if, and I'm sorry, my camera is moving just a little bit. Can you still see me?
I can still see you, but yeah, it is moving a lot.
Okay, I'm very sorry about that. I
That's
should have
okay.
brought my stabilizer. Uh, but as far as, is that a little better?
Yeah, that's good right there.
Okay, so as far as I call them in, I talk to them, and then I try to get them to come to see if they even realize that what they're doing is not meeting proficiency, or because they,
Mm,
you know, you're only as good as the person that trained you. I always
that's
tell
right.
new hires that. When you first start off, you're trained by different clinical coaches and people that help and mentor you. You may have been trained to do it the wrong way. So I try to talk to them first to find out what they see in their performance. And if they can come to the middle term with me, that's when I bring in, tell me some things you feel like, then that would improve that. And we try to make a plan together. Okay. Part of the plan is them first trying to realize that there are some deficits. Because until you get someone to realize that there are deficits, um, what it becomes then is a back and forth. No, I never do that. Everyone says you leave 15 minutes early one day, every day, and the floor is not covered. Oh, I never do that. But doing observed, documented occurrences, then they might say, well, yeah, a couple of days I did leave early. And you try to get them to some middle ground till they take ownership for their behavior.
Gotcha.
Um, and then you make a plan with them, okay? As for the people who are complaining, I'm not going to go back to them because it's a private conversation. I'm not going to go back to them and say, well, I talked to this person, and because that's not what you do. You maintain professionalism, integrity, but if you're complaining all the time, then I'm probably going to try to engage you. Well, how can we help this person? Would you like to work and mentor them again, since you're saying that they never complete their assignments? And then, if that person that's complaining doesn't want to help, then I call them in and try to get them to see that you are not helping the situation. You are uh,
A
bringing
part of the
about a situation that will cause more discord on the unit. My mother used to always tell me, if you can't do something to help someone, shut up. So I'm not going to tell them to shut up, but I do want them to understand that part of it is, unless you're bringing positive encouragement to this, I do need you to do your job and let me handle this. But if you're willing to help, I would love for us to help mentor this person to be a better person.
That is such a great idea, such a great idea. So thank you so much for coming to us. And I'm not sure who this person said. Thank you for training me, because I can't see the Facebook users on the
Uh-huh.
StreamYard platform. But whoever that was, I love you. I will train you for any day. You're amazing, because anybody that I train is amazing. They all are.
Yeah,
Every last one of them. I can name them all out, but anyway, we won't do
yeah.
that. So my name is Dr. Viola Pearson, owner and the CEO of VP Nursing and the Nurse Nurturing, and this facilitators of Secret Suppers Worldwide with Dr. V, where our goal is to equip healthcare professionals to be wealthy in all areas of their life. Our goal is to come to you each Monday, Wednesday, and Friday at 7:30 a.m. Eastern Standard Time to give you the fuel to crush your goals and to show up exceptional on a daily basis. You can follow us on Twitter, The Nurse Nurturer, Instagram at VP Nursing. And if you're watching on YouTube, don't forget to hit the subscribe button and please share this video. You can also follow us or visit us at our website at vpnursing.com.